Hello, everyone. Bonjour à toutes et à tous. As usual, I'll start with the update on the numbers of COVID-19 cases in Canada. So there are now 14,426 cases, including 258 deaths. The highest proportion of deaths among those aged 80 or older. So obviously keeping seniors safe is a very critical part of what we need to do. And again, remember that these cases represent previous exposures, but we need to thinking about what the risks are now. This means the best bet is to consider that there could be community spread wherever you are, and always practice physical distancing by keeping a 2-meter distance from others. So Canada has completed over 323,000 tests for people in Canada, and just over 4% of these have been confirmed as positive and 95% confirmed as negative. Each day we are adding to our knowledge of COVID-19, keeping pace with the rapid growth of new scientific evidence as it emerges. This has been and continues to be critical to how and when new decisions are taken. There are times we will act with speed over perfection when the price of inaction is high. In other cases, we must wait for the science to catch up while layering up with all the protections that the science has proven time and again to work. So this is why I have been a broken record about tried and true public health measures. We know these work and that they can plank the curve. So we can all get it right. Kids across Canada are asking, what is flattening the curve? They are giving up soccer games and play dates and not going to school to help plank the curve. They are learning about social distancing and hand washing while singing different tunes and doing their part to help slow the spread of the virus. This is great, and we can all do the same. We know that these efforts require sacrifice, so we must undertake them together, taking care to look after one another and also to look after our own physical and mental well-being. COVID-19 has reminded us of both our vulnerability and our interconnectedness. We are stronger together. Thank you.
Bonjour. Comme d'habitude, on va commencer en faisant le point sur le nombre de cas de COVID-19 au Canada. En ce moment, 14 426 cas au pays, dont 258 décès. Même si ces cas découlent d'expositions antérieures, il faut maintenant penser au risque d'exposition. Plus précisément, la meilleure chose à faire en ce moment est d'agir comme il y avait transmission communautaire de la maladie dans la région où l'on se trouve et de pratiquer un éloignement physique en se tenant à 2 mètres les uns des autres. Nous continuons d'effectuer de nombreux tests au Canada. Plus de 323 000 personnes ont été testées. Plus de 4% des cas de ces personnes ont obtenu des résultats positifs et 95% des résultats négatifs. Chaque jour, nous en apprenons plus sur la COVID-19 en nous tenant au fait des nouvelles données scientifiques à mesure qu'elles sont diffusées. Ces données continuent de déterminer quand et comment se prennent les décisions. Nos actions doivent être plus rapides que parfaites lorsque l'inaction risque de nous coûter cher. Dans certains cas, nous devons attendre que la science se rattrape et appliquer toutes les mesures de protection qui, d'un point de vue scientifique, ont toujours été efficaces. C'est pourquoi on se répète comme un perroquet sur les bonnes vieilles mesures de santé publique. Nous savons qu'elles fonctionnent et qu'elles peuvent nous aider à aplatir la courbe si nous réussissons tous à les appliquer. Les enfants de partout au Canada nous demandent ce qui va aider à aplatir la courbe. Ils renoncent à leur partie de soccer et à leurs activités avec leurs amis pour aider. Ils en apprennent sur l'éloignement physique et le lavage des mains, au rythme des différentes cantines. Ils participent aux efforts pour ralentir la propagation du virus, ce qui est excellent. Suivons tous leur exemple. Nous savons que ces efforts exigent des sacrifices, Alors, travaillons ensemble. Prenons soin les uns des autres et veillons à notre propre santé mentale et physique. La COVID-19 nous a rappelé à quel point nous sommes à la fois vulnérables et interdépendants. Nous sommes plus forts ensemble. Merci.
Okay, thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to one question and only one follow-up. For those asking a question in the room, we do ask that you make your way over to the freestanding mics here. Operator, over to you for 2 questions on the line.
Thank you. Please press star 1 at this time if you have a question. There will be a brief pause while the participants register for questions. Thank you for your patience. Et s'il vous plaît, appuyez sur étoile 1 pour poser une question. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Merci de patienter. La première question de Mia Rapson, the Canadian Press. The first question from Mia Rapson from the Canadian Press. Please go ahead.
Good morning, Dr. Tam. I'm wondering if you could talk a little bit more about face masks in terms of, you've said many times that Canada wants to be a lot more like South Korea and Taiwan than let's say, Spain or Italy. But these are countries where they told people to wear face masks quite early on. Are you concerned that not giving that information to Canadians has contributed to the spread in Canada?
So we're always looking at evolving science, but some of the really critical measures is staying home and self-isolation. So whether someone is symptomatic, of course you should stay home. The question of the evolution of science on the how much pre-symptomatic transmission, for example, contributes to the epidemic is still undergoing evolution in terms of the science. However, if people who are meant to be self-isolating, stay at home, if you quarantine, those 14 days are there so that if you become symptomatic, you're already apart from others. So those are absolutely critical measures. Case finding, contact tracing, and social distancing. As I've said yesterday, we are actively reviewing the evidence right now with the provinces and territories. We'll have more specific recommendations in a very short time frame. I did say, though, there are 3 really critical aspects to our advice to Canadians. One is that right now, medical masks, including surgical and medical procedural face masks, respirators like N95 must be kept for healthcare workers and others providing direct care. Secondly, again, non-medical masks. So these are some of the examples that people have talked about in terms of homemade masks. In the community hasn't proven to protect the person wearing it from getting the virus. So everyone must still practice strict hygienic measures and the social distancing measures. Stay home if you're sick. Wearing a non-medical mask is an additional measure that we're considering to protect others around you. So it's a matter of you protecting others. So these are the 3 key aspects. And what we want to do is to provide thoughtful advice to Canadians so that if they wear a mask, how do you do this properly? And I want to make sure we have good advice on, even amongst homemade masks, how do you do that properly? What materials are appropriate, for example? So all of this is under active discussion right now.
Thank you. One follow-up?
Thank you for that. I'm also wondering if you could talk a little bit about protections for healthcare workers. We've heard in other countries the number of healthcare workers that are falling sick is quite high, and here, without proper protection, seems that those numbers are there. What are you specifically trying to do to prevent those kinds of things from happening here, and why can't we know specifically what the shortage is of masks for healthcare workers?
So protecting healthcare workers is absolute priority. It is of paramount importance. So as we've all been saying, every stop has been pulled out in terms of getting supplies. And globally, there is a very much a sort of competitive environment and a shortage environment. So we are doing everything that we can, not just getting PPE from overseas, where traditionally that's where they come from, but also the domestic supply. So some of these things are coming online and being delivered. But every day those numbers will change, and depending on the utilization of the mask and the deliveries. But we are also looking at very other measures, such as how can we disinfect, if you like, or decontaminate masks? How do we best look after the limited supply that we have? And many of the other measures, for example, that provinces are taking is ensuring that they designate wards or hospitals just to look after COVID-19 patients. And that also helps the stewardship and the conservation of personal protective equipment, because it'll be one specific area or one specific hospital where patients are being looked after so that they can look after that supply of the PPE. So many, many things are being done to ensure that we protect health workers. And the other thing is, getting a better understanding of the healthcare workers who are infected. I do know that, for example, it's not as simple as people think. Many of healthcare workers were perhaps infected in the community or through travel, and not necessarily through the actual healthcare facility. So you need to actually understand a medical officers at the local level is in a very good position to understand the exact reason why healthcare workers have been infected, but also to protect the patients that they are trying to take care of. So that's really critical.
Thank you. Operator, next question on the line.
Thank you. The next question from Philippe Vincent Foisy from Radio-Canada. La prochaine question de Philippe Vincent Foisy de Radio-Canada. Excusez-moi, la prochaine question de Carly Weeks. Philippe Vincent Foisy qui avec la question.
Oui, allô?
Oui, la voix parole, Monsieur Vincent Foisy.
OK. Monsieur Njoo, la semaine dernière, vous avez répété que c'était une semaine critique. Vous avez dit ça toute la semaine est terminée. Est-ce que les Canadiens ont réussi l'épreuve? Est-ce que la semaine critique, elle est positive ou négative?
Merci pour la question. Oui, la semaine dernière, c'est critique, mais aussi cette semaine actuellement et aussi les prochaines semaines. Une partie de l'enjeu actuel, c'est toujours les données. C'est sûr que qu'est-ce qui se passe actuellement avec les données qu'on reçoit à l'échelle fédérale? Il y a déjà, ça représente les cas avec peut-être l'exposition il y a 2, 3, 4 semaines. Parce qu'il y a toujours des délais avec une personne, avec une période d'incubation. Puis si une personne tombe malade, chercher soins de santé, avoir un dépistage, un test, et puis les résultats des tests, et puis les rapports qui commencent à l'échelle locale, municipale. Et puis, ça monte à l'échelle provinciale, finalement, à nous autres. Donc, pour nous, c'est difficile à déterminer précisément à l'heure actuelle si on a fait on a réussi, mais si on voit qu'est-ce qui se passe dans les provinces et territoires individuels, comme en Colombie-Britannique, les autorités sanitaires ont dit que oui, il y a peut-être des résultats un peu optimistes, mais il faut prendre ça avec un peu comme des précautions parce que à l'échelle nationale, c'est difficile. Donc, je pense que la chose la plus importante, c'est d'encourager tous les Canadiens. C'est très important de continuer avec les mesures comme l'éloignement physique. On verra peut-être dans les 2-3 semaines qui suivent. Merci.
Puis un suivi?
Pardon?
Votre suivi maintenant?
Oui, j'ai posé ma question de suivi. Sur les masques, le gouvernement du Québec, la semaine dernière, disait que ça prend à peu près par semaine 1 million, en tout cas quelques millions de masques chirurgicaux, des millions de masques N95 aussi pour tout le système de santé. Ça, c'était juste au Québec. Partout au Canada, avez-vous un chiffre à peu près du nombre de masques que ça prend par semaine? Puis j'aimerais ça comparer avec la quantité de masques qu'on va recevoir de la Chine. On parle de 7 à 8 millions de masques. C'est suffisant, ça, pour quoi? 1, 2, 3 journées? Il nous reste de l'équipement médical de protection pour combien de jours jusqu'à ce qu'il en manque?
OK, merci pour la question. Oui, c'est un enjeu actuel. Tout le monde travaille très fort, le gouvernement fédéral, en étroite collaboration avec toutes les provinces et territoires, parce que c'est vraiment, comme on dit, c'est l'équipe du Canada. Le gouvernement fédéral, avec les provinces et territoires, on fait des commandes, comme on dit, des achats en gros, et puis après, c'est une distribution selon un cadre d'allocation pour les provinces et territoires. Mais on sait ici, il y a des foyers actuels dans des régions spécifiquement, dans chaque province et territoire. C'est ça, c'est une priorité pour distribuer l'équipement de protection individuelle aux foyers où on a besoin. De plus, c'est difficile parce qu'on ne peut pas donner des chiffres exacts parce que c'est très fluide la situation avec les vols, la distribution, qu'est-ce qui se passe actuellement. Si on donne un chiffre maintenant, c'est sûr, peut-être dans quelques minutes ou quelques heures, c'est plus en vigueur. Donc, je pense que la seule chose qu'on peut dire, c'est qu'on continue à travailler étroitement. C'est toujours une situation qui évolue de jour à jour et on fait nos meilleurs efforts. Un autre aspect, c'est même si on continue à acheter ce qui est disponible sur le marché mondial, on continue aussi avec nos efforts pour avoir une capacité domestique pour la fabrication des masques ici au Canada pour toujours la priorité des travailleurs de soins de santé sur le terrain. Un autre aspect, on est en train aussi au Canada de faire la recherche. Les chercheurs aussi sont en train de trouver peut-être des moyens. Est-ce qu'on peut désinfecter l'équipement de protection individuelle déjà utilisé? Peut-être c'est une autre façon de conserver l'équipement qu'on a déjà ici au Canada. Donc, on a plusieurs volets, plusieurs composants de vraiment l'enjeu de l'utilisation et aussi de la distribution des EPI. Merci.
Thank you. We'll come to the room now for...
Should I repeat in English or?
Sure. Please.
Same question. Obviously, Dr. Tam and I, we've been repeating. It's a very live issue in terms of getting the necessary personal protection equipment for our frontline workers, especially healthcare workers. It's difficult to give exact numbers because it is a very competitive global market. Certainly, we're pulling at all the stops. The federal government, in collaboration with the provinces and territories, we have what we call an allocation framework, so that when masks do arrive, there is a mechanism in terms of how we would distribute. Obviously, there are lots of factors in play. For example, if a given part of the country has a specific outbreak or a region that's particularly affected, certainly that would be a priority to get the masks that are available to that specific area. In addition to, obviously, the very competitive global market, we're also looking at increasing our domestic capacity. That won't happen overnight, but certainly efforts are underway to make sure that here in Canada, that we have the capacity down the road, hopefully sooner rather than later, to make, quote, our own personal protective equipment. So that's number two. And then number three, we're also actively with our researchers across the country looking at other ways that maybe we can even reutilize masks, as Dr. Tam was just saying, in terms of disinfecting them so that they can be used again. And that way we can also conserve the PPE we have here in Canada. Thank you.
Thank you. We'll now come to the room for 2 questions. Mackenzie.
Hi, Dr. Tam and Dr. Njoo. Mackenzie Gray from CTV. Dr. Tam, yesterday when I asked you about masks, you said that the main reason why someone who wasn't sick at the point of showing symptoms should wear a mask is to not give droplets to someone else. That, to me, made it sound like there is some science that you've been looking about asymptomatic transmission or pre-symptomatic transmission. Can you speak to what the science is right now? And very specifically on that, in the period before someone shows symptoms, how early are they able to spread COVID?
So we are actually right now going to be reviewing this with the other chief medical officers and in terms of the studies that are available. They are actually limited. So with that, we will still be making some recommendations. What we do know is if you put a swab into someone's nose and throat, you will get the virus identified before someone is symptomatic. So that is a fact that we know about. When does someone transmit? That is the more difficult question. So there has been some studies, some of which are released in the last few days. For example, a study in a long-term care facility in the United States is showing that people who are pre-symptomatic, they will become symptomatic, but maybe 2 days or so. So we're looking at that period, you know, how certain are we about 2 days, 1 to 2 days, 2 to 3 days, looking at that period that they could transmit before they have symptoms. We still believe that people with symptoms is the main force overall for the propagation of the actual outbreak. But in certain settings, as you can imagine, like long-term care, it is really vital to look at that because it can change practice, including the use of PPE, so that staff may not realize that they will become symptomatic, or residences who have many other medical conditions, for example, you can't tell. There are other things that we should be doing as well. So that's the live discussion that we're having, and we will be providing more information on that to come. There's also other laboratory studies where people are made to cough or do other things to see whether they can spread. And so there's different groups of studies that we're looking at right now.
One follow-up?
President Trump has been discussing the anti-malaria drug, and forgive me for the mispronunciation, hydrochloroquine, you two know what I'm talking about, as a potential treatment for this. What is Canada's position on this? Have we used this drug to treat people in Canada at any point during this? And it's also a drug that is used for lupus, according to my understanding. What are we doing to make sure that there is this drug set aside to make sure that people who need it for conditions that we know it'll actually help, to make sure that those drugs are there for them?
That's a very good question. We do not have any specific treatments, and none proven to work for COVID-19. But hydroxychloroquine is one that is being studied. So in Canada, we are part of those studies. So ensuring that we have hydroxychloroquine so that people who use it is part of a clinical trial. You can get data from them is part of what's going on right now. In terms of absolutely, I think our key message is that we do know this drug works for certain medical conditions. People with certain inflammatory illnesses, some of the immunological illnesses that you've talked about, malaria, prophylaxis, you must preserve those actual indications. So that we are working on that with Health Canada, that's the regulatory authority, with the manufacturers, and there are several of them. Some are manufactured in Canada. So we are monitoring the supply situation and looking to what we need for the purposes of patients who need them and the trials that it needs to be conducted. But it's definitely one on the list of treatments that we are looking at for COVID-19.
Ashley Burke, CBC News. You just mentioned you're monitoring the supply of that specific drug. Can you tell us about how much of it we do have here in Canada, and do we rely on a large bulk of it from the U.S.?
I know that there's several suppliers, and I know that there's domestic manufacturing. So I think I also know that there's a very a great deal of interest globally. So we are very alive to the fact that this supply, which we have, we need to, really, if we need to augment it, there is a domestic capacity to do so. But making sure we have enough of the patients that actually need it for other purposes, I think, is our primary concern right now. And so, but there is, I think, from my perspective at least, we have domestic capacity.
You were just talking about decontaminating and disinfecting masks and that process. Can you give us some more specifics of exactly what type of work you're doing right now on this, where we are at the process and how close we are to actually doing this? As well, what does it signal about our supply here?
So I think it's a multi-layered approach to the supply, and I think everyone is aware that the supply is a very dynamic situation, but there's a lot of need. So this is another method. So part of it is the science of decontamination of what works. And secondly, we are looking at multiple entities in Canada that might be able to actually do this. And also then signaling to provinces and territories that certain things shouldn't be thrown away right now, so that we can actually implement this should we find the actual people who can do this. But I think that is one of the most important and I think worthwhile lines of pursuit for PPE right now.
Thank you. We're going to go to the line for 2 final questions. Operator, over to you.
Thank you. The next question is from Carly Weeks from the Globe and Mail. La prochaine question de Carly Weeks du Globe and Mail.
Hi, and thank you. Dr. Tam, I was just wondering if you could address something. You said last week this would be a very critical week in terms of cases and numbers. We have heard from officials in BC and to a lesser extent Alberta indicating that they may be seeing a bit of a slowdown. On the contrary, it seems as though the situation in Ontario and Quebec provinces that you singled out last week are accelerating. I was wondering if you could comment on how some of those situations might be evolving and what you're going to be looking for in the week ahead.
Yeah, I think that's actually quite a good summary. We will be looking towards British Columbia and maybe Alberta because they have a very different epidemiology to Quebec and Ontario. I think all chief medical officers are trying to be extremely cautious about what we're looking at because we know the situation can change. And with the delay in terms of what you're seeing right now in terms of numbers, again, is what happened several weeks ago. So that is absolutely important for everyone to know. And as I've said before, you won't know that you've passed a certain peak until you're actually on the other side of it. And it's always very difficult to make any pronunciation on that. So it is a day-by-day look. And so then I do think that Quebec and Ontario, even individually, have different epidemiology and different timing and trajectories. So Quebec's dynamics will be different to that of Ontario, to be able to watch this day by day. But just to really emphasize that what things happen in the next ensuing weeks is dependent on what we do today. So if we don't keep on going and absolutely tighten up our social distancing, self-isolation, case contact measures, that's what's going to impact a couple of weeks down the road. So that is a really important concept that everybody has to grasp. What will happen 2 weeks down the road is what happens today. So it's just a concept that I think Canadians need to be aware of.
Thank you. And one final question on the line.
The next question is from Mo Fahim from Vista Radio. La prochaine question de Mo Fahim de Vista Radio.
Hi, good morning, doctors. My question is regarding, is the federal government considering to emulate how some Eastern countries are providing accommodation for healthcare workers so that they can absolutely minimize any contact between them and people around them? Is the federal government considering anything close to that?
We are looking at everything, basically, to slow down the spread of the virus in this epidemic. And so these are some of the kind of discussions that we do have with provinces and territories. That's a very good question. And if you look at what the provinces are already doing, I'm aware, for example, yesterday Manitoba actually articulated the precise thing that you just described, is making sure health workers, should they need a place to self-isolate, to not just protect themselves, but to protect their families, they're looking at the support for them to do so. So absolutely, that's one aspect of our response that we can offer support for, should that be needed.
Thank you. And one follow-up?
Thank you. I don't have a follow-up. Thank you so much, doctors.
Merci. La séance est maintenant terminée.
Thank you. The conference is now ended. Please disconnect your lines at this time.
No, just gonna ask her.